Good afternoon, Trinity County and our news media partners. My name is Liz Hamilton. I'm Interim Health and Human Services Director and Office of Emergency Services Director. Today we're going to hear from a panel. They'll come up one at a time, just introducing the format to you. We'll hear from Marcy Jo Ketzel, our Public Health Nursing Director. She'll report out. Then we'll hear from Christy Anderson, our Environmental Health Director, followed by our Trinity County Sheriff, Tim Saxon. Afterwards, we will review questions that the media is submitting via email that our County Administrative Officer, Richard Coons, will read, and our panel will answer those questions. So with that, we'll start with Marcy. Thank you.
Thank you, Liz. Good afternoon. I'd like to give you an update on some of the numbers in Trinity County and our responses, and hopefully be able to address some of the concerns that the public has around this. To date, there have been 41 coronavirus tests conducted, with 36 negative and 5 pending. Our Trinity County Public Health Branch Operations Center continues to fully operate. It's fully staffed, and we're coordinating efforts with our OES, our law enforcement, our health officer, and other state and local partners. As of this AM, we have sufficient PPE, personal protective equipment, for our healthcare partners. We're not experiencing at this time any information that there's a shortage of testing for our providers. Our public health DOC has procured pop-up infirmaries for our healthcare system in order that they can separate potential COVID patients from other patients during the triage phase, as well as providing treatment. This is prior to hospitalization. We are working with healthcare partners and looking at hospitalization and what that looks like in our county and throughout the state. I would like to bring the public and the press up to speed on some of the aggressive policies that we've put into place and the reasons we've done that, and ask for your assistance in helping us prevent the spread of coronavirus in Trinity County. There are three main driving forces for implementing the aggressive strategies of social distancing, isolation, and quarantine. Number one, we are a rural frontier county with limited resources. Number two, we are in a pandemic. This is unprecedented, and healthcare resources are needed at an unprecedented rate in our county, state, and nationwide. Number three, lessons learned from past pandemics are that these strategies slow the spread of the illness, which buys us critical time to respond. It is absolutely vital that we aggressively slow the spread and the potential spread of COVID in Trinity County, to buy us time to ensure our local healthcare system and those throughout the state are better positioned to deal with the surge created by COVID. And this will protect the most vulnerable populations in our county and those who can develop severe illness and poor outcomes. We want to have the best chance to be able to respond to the healthcare needs of those with COVID, but also prevent indirect morbidity and mortality. And in that, we want to make sure other healthcare services are available, such as trauma care and other emergent care. So I'd like to clarify what isolation and quarantine mean. There's a lot of confusion out there. First of all, I'd like to say the essence of what we're doing with these aggressive policies is preventing the spread of coronavirus. I know you've heard Governor Newsom mention in his news conferences changing that epi curve. We want it to go from this to flatten it out, okay? That buys us time. We want you to know that we expect that testing will be exponentially higher over the days. You're going to see testing go up. We don't want you to be alarmed by that. That's a component of surveillance. And who we're testing is as important as the tests we do. Right now, it's not recommended to test those with mild illness. We are testing those that have symptoms consistent with coronavirus to be able to isolate those that are ill. Isolation consists of separating someone who's ill from other people. The CDC recommends, and we are implementing, if someone is ill, they are potentially, either they've been tested and are waiting for results, we call those persons under investigation, or they are ill and they haven't been tested and we don't know what they have. The recommendation is that those people stay away from other people. If they exist in a facility with someone, a home, another facility, that they stay at least 6 to 10 feet away, that they wear a mask if they have to be in contact with someone closer than 6 feet, or they have to go out in public. Ideally, they share a separate bathroom, a separate bedroom. They use separate eating utensils, frequent hand washing, frequent touch surfaces should be wiped down. That's isolation. Quarantine is when we're asking people that may not be ill to stay away from public places, and except for essential needs. So I know there's some confusion around that. So quarantine means that, for example, someone coming into Trinity County, either repatriating from another place, that they were part of like a cruise ship or something, although that has passed, I think. We're having community spread, so it could be someone coming from, say, another county where there's community spread. The problem is since we have widespread community spread throughout the state, it could be someone can come from any given county, and we don't know their exposure status. We do know that the incubation period is 14 days. So what we're asking and implementing this aggressive strategy of ensuring that people that repatriate or are coming into the county from other places, either to visit friends, family, to stay over time in a hotel, in an Airbnb, to isolate themselves, quarantine themselves for 14 days. That's because by 14 days, we know if they're generally going to have the illness, because that's the incubation period. So I hope that helps to answer some questions. It may not answer all your questions, but I would refer you to our press releases and to our website, trinitycounty.org. There is a multitude of information on a regular basis that will keep you up to date. And now I'd like to introduce our environmental health specialist, Christine Anderson. Christine.
Good afternoon. So I wanted to say that we do expect the public to follow the governor's order to stay at home, and we also expect businesses to regulate themselves and follow the health officer's order. So the last couple of weeks we've been really focusing on businesses, including food facilities, bars, hotels, motels, VRBOs, Airbnbs. We sent out closure notices that became mandatory for the bars. We also sent out notices to every food facility telling them to restrict their business to no dine-in and delivery and takeout only. We do understand this is a hard time for local small businesses. However, it's necessary to protect the public. We also released press releases with every amount of information we've been sending out. We've also released question and answer documents to our food facilities and to the public in general regarding the stay-at-home order. You know, go outside, walk your dog, things like that, but try not to go on the playground equipment and stay 6 feet away from your friends. Also, following the press release Monday, March 23rd, which went out to all of the county regarding travel and stay in Trinity County, we sent out guidance to hotels, motels, VRBOs, bed and breakfast resorts, and seasonal RV parks with a questionnaire enclosed upon check-in for any individual. This kind of helped them outline what is essential travel needs and what is not, and also instructions on who to get a hold of in public health and our OES. We are also taking the stay-at-home orders very seriously, and we hope, and we expect that everybody follows those orders. Thank you. And I want to introduce Tim Saxon, Sheriff.
Good afternoon. First, I'll start off with just a little bit of in-house what we're doing at the Sheriff's Office. Jail operations. Right now, jail operations are continuing as normal. As of this morning, we have no illnesses reported inside the jail among the inmates. A couple weeks ago, we suspended all visitations. And recently, we did amend our contract with telephone services to provide limited, no-cost phone contacts so the inmates could have some visitation with friends and loved ones outside. We're working on video visitation for the future. Our administration office has been closed to the public. Most of the functions are continuing by phone, mail, fax, and email. Our patrol, dispatch, and 911 functions are operating normally. Now, the Sheriff's Office priorities are continuing to remain the same, and that is protection of life and property. We're urging voluntary compliance and social pressure to follow common sense. Stay home. We want to focus on how to keep you safe, your family safe, and as the main purpose of the order, to try and keep each of our communities safe. Now, with that being said, the governor's order and the public health officer order, they are enforceable if necessary, and only as a last resort. Our objective is to seek voluntary compliance through education. All of us need to continue to work together. So please help us. Keep yourself safe and healthy by practicing the recommendations given by the public health officer. And in closing, I just want each and every one of you to please recognize the nurses, the doctors, the ambulance crews, the volunteer firefighters, law enforcement, public health, all the public safety workers. They're dealing with this crisis each and every day. I want you to know that we're staying at work. So I'd like each of you to please stay home for us. Thank you.
Please head up or okay. Well then, who wants to stream this? I have two questions from Channel 7 News. The first one is, with Highway 299 being a thoroughway from the coast to I-5, are travelers able to stop in Weaverville, fill up, buy groceries? Are we closing that down to travelers?
That's a really good question. I'm going to let my partners answer that. I just want to reiterate the important thing we want the public to understand is this is really, let me bring it back to common sense stuff. To prevent the spread, we limit contact with people and things, and we want to conserve whatever resources we can. And I'll hand it over to Christy regarding, or our sheriff regarding enforcement.
Just like to say the highway remains open. People are free to go through Trinity County. We just ask if you do stop, if you're sick, please take the necessary precautions. Please do not go into the stores to spread any virus if you're sick. And please make sure to wash your hands, take the necessary precautions, and just have a safe travel through Trinity County.
I concur with Tim's statement. Absolutely, if you need to stop for necessary services. Thank you.
And then our last question is, with the growth number in Humboldt County as it increases, is that a concern to Trinity County, being that we share borders?
I'm sorry, could you repeat the first part of that?
It refers to the amount of cases we have now in Humboldt County, and is that a concern for Trinity County as we share borders?
So let me just state this, because public health is very good at this. We work with our other county partners. We work with our regional partners, our state partners. Because this is a statewide pandemic, at any given time throughout the state, and because of the way we travel, it's equally as concerning that there are cases in Sacramento. So we really look at a statewide situation of how many cases there are, how many resources there are, how we manage to that. We are monitoring and we are in communications consistently and constantly with our partners in Humboldt, our partners in Shasta, our partners in Del Norte, our partners in Butte, partly because we share resources and we share expertise. And so I hope that answers the question. I think that was a very good question, and thank you for that.
And that's all we have from the media at this point.
So to our viewers and our media, we thank you for taking the time to tune in. We will be scheduling routine news conferences to answer questions that the public has. Thank you.
Okay, that's all.
Yeah, that was excellent.
Very, very well.